Do you know somebody who's got breast cancer, or do you have breast cancer? And do you know that the majority of women that get breast cancer do not have the BRCA1 or BRCA2 gene? The main cause of breast cancer is poor methylation. What is methylation? Well, methylation is a few things, but in the context of breast cancer, methylation is the ability for the body to make sure that the estrogen byproducts or metabolites are safely broken down, and then they can be ready for disposal through urination and also through your digestive system. So methylation is a process that's important. It's happening every second in your body, but what it needs a lot of core factors. So think of it as a factory that makes a certain product, and you need to have certain things in place for you ultimately to be able to make that product. So if a person has got poor gut health and they are not absorbing a lot of these core factors that are needed for methylation, think of things like B12, B9, B2 that we find in food. And also some people have got genetic predisposition where their ability to break down these estrogens safely is poor. So how do you know if you are a poor methylator? How do you know if this particular process that I'm talking about that is not happening well in your body? There are a few ways to check. If you have a visit at a good functional medicine practitioner, they will be able to tell through your symptoms that most probably you are not methylating very well. There are lab tests that can be done. For example, checking the level of homocysteine in the body. You can also do a DNA test which shows your predisposition to poor or good methylation. You can also do a hormone test called a Dutch test, which is a dried urine test for comprehensive hormones. So all these tests would be able to determine if somebody is methylating poorly, and also checking their genetic predisposition. So the thing is, you can take action. It's not just a question of like, I am a poor methylator, what can I do? There are a lot of things that you can use to make sure that you are breaking down your estrogen safely, because if you don't, those byproducts of the estrogen, they can damage your DNA, and the damage of the DNA is the breast cancer.